Having a lucky day can mean very different things to different people. For me, it might mean that I avoid traffic on a work day or that I nail my 3MT presentation. Patients with rheumatoid arthritis also hope for lucky days, but their hopes sound a bit different. Will I be able to go to work today? Will I be able to climb the stairs? And after waiting for 6 months, will I finally find out if my medication is working? As you can see on the left, rheumatoid arthritis is a highly disabling chronic disease where the body's immune system attacks the joints, causing severe pain and inflammation. On average, someone with rheumatoid arthritis will be work disabled within 10 years and have their life expectancy reduced by 30%. And worst of all, there is no cure. The best that we can do right now is placing patients on drug therapies as early as possible. But for the 1 in 3 patients who don't respond to their first treatment, there is still a major obstacle. And that is that current treatment monitoring methods take about 6 months to identify whether or not a treatment is even working for a patient. That's 6 months of costs, pain, and irreversible joint damage. For these patients, getting the correct treatment can often feel like trying to hit a dartboard in a dark room. Not only is it difficult to hit the target, but the only way to find out if you hit it is by slowly fumbling around to the other side and trying to find your dart. The feedback is way too slow. So my project is focused on building a system that'll get patients better feedback. Recent evidence is showing us that blood flow levels in the joints are associated with disease activity. So I'm building an imaging tool that can help track blood flow levels in patient joints in order to determine whether or not they're responding to their treatment. The system works like this. We place a patient's hand on a platform and image it using light. We then also place a pressure cuff on their arm and inflate it so that blood pools in their hand for a few seconds, and that causes more light to be absorbed. We capture this difference using a camera and then work backwards to determine how fast blood must have been flowing into the area. And that's it. Using this general principle, we can measure blood flow values in patient joints and hopefully identify whether or not they're responding to their treatment. So they no longer have to wait 6 months for an appointment where they find out that their therapy wasn't doing anything, so that non-responders can be identified sooner. Because for these patients, getting the correct treatment can often feel like trying to hit a dartboard in a dark room. So I'm building a system that'll turn the lights on and give these patients the feedback they both need and deserve. Thank you.